96% of Americans fundamentally don't even understand the terms that they're looking at when they're asked to select a particular health plan. It's purposefully complicated to confuse people.
Why are they able to charge so much for something that you can get for so much cheaper somewhere else at any other time?
Well, because they can get away with it, you know?
But somehow the consumer, the patient, these human beings need to be protected in their most urgent and vulnerable conditions from the most sophisticated and deliberate predators that we have ever seen in America.
It's going to take a very deliberate sort of critical mass sort of rising up and saying enough.
The U.S. healthcare system is broken. Well, actually, it's worse than that because the companies that make up the system are providing such a bad service for so much money, it should be criminal. But the ways they are getting away with it aren't as obvious as you might think. So let's dive into how these companies are getting away with pillaging the American people. I'm Jack Murphy, and this is Dr. Sundeep Palakadetti. We call him Dr. Deep. He is our chief medical officer here at Rebel Health Alliance. Dr. Deep, how you doing today, buddy?
Hey, Jack, doing great. How are you?
I am doing very well. Happy New Year to you, sir. And we are here to talk about something which isn't really that savory, to be honest, because once you start digging into just how bad the healthcare companies are screwing us all over, it becomes absolutely enraging. And in fact, I've seen you describe them on social media as a cartel to be prosecuted by RICO. Is that right?
I absolutely believe that we have the precedent and the evidence to suggest that especially large health insurance companies are acting in a colluding fashion that frankly puts people at harm. And there's all sorts of data that we'll cover and share during this episode to explain why. But, you know, we are all victims of the healthcare gangsters and the pillaging that we see every single day.
Well, I, for one, am interested to dig into this. And I think that when our viewers hear all the various ways that the healthcare companies, the insurance companies, the healthcare hospital systems, the pharmacies, et cetera, are working together to really give us probably less than even minimally acceptable healthcare at maximal cost to all of us and running away with bags of money in their hand to the bank, that every single one of us is going to want to escape and run away because fixing the problem probably isn't even that possible. We're going to have to build a whole new system and just throw the old one in the trash. So let's get into it. Let's talk about some of the high level issues that we're dealing with here. First off is just the high level of costs. Costs seem to have skyrocketed every year. People are paying more money every year for the healthcare. Is that right?
Yeah, Jack, it's actually quite sobering when you take a step back and think about it. You know, I'm a physician and my wife is a professional and we've got great insurance and we're expecting our second child right now, any day, actually. During our first pregnancy, after it was all said and done, we got a bill for something around $8,000 out of pocket. That's after paying all of our premiums, all of our deductibles, and it's an abomination. You know, none of us should sort of live with that and understand with no understanding of kind of how much anything costs in healthcare. You know, I have a lot of stories, unfortunately, that are quite heartbreaking around how healthcare costs are actually harming everyday Americans. Let me tell you one. I took care of a patient early in my career. Her name's Veronica. I'll change her name for the story. But, you know, she came into the clinic with symptoms, signs that were typical for kind of an ulcer in her stomach. She had that gnawing kind of feeling and was throwing up and nauseous a bit. And so we ended up doing some tests. And unfortunately, it wasn't just an ulcer. She had gastric cancer. Now, mind you, this is a 40-something-year-old woman. Her significant other had passed away. She's on, she's the responsible party in her family for taking care of her aging mother, her young son, and now she's sort of laid on this devastating diagnosis. Thankfully, you know, the modern marvels of American healthcare, we are great at treating sick care. As we mentioned in our sort of initial video on the American healthcare system, we don't tend to prevent chronic conditions very well, but certainly once you need an expensive procedure, America is kind of the place to be. So, this patient has insurance or had insurance and was kind of going through the right processes, and we got her into an oncologist. We got her in for surgery, and she came back to me, maybe 3 months later after it was all said and done, and we were reviewing her scans, and it was this beautiful moment where we had essentially cured her of cancer. She had no further sort of signs, and they'd resected the mass. We got in front of it early enough, and we were ecstatic, and there were tears shed. But the tone sort of turned somber. She reached into her bag and pulled out a folder and showed me sort of what the overall bills were that she was facing now. And it was around $40,000 of out-of-pocket cost that this poor woman now had to endure. She was making heartbreaking decisions now about, whether to buy a wheelchair for her mother or get, help for her son, or pay for her own medical care. And in the most advanced country in the world, when we have the highest healthcare expenses, when we pay the most as individuals and families and employers for healthcare, to be able to cure someone, but then laden on another chronic disease of medically induced poverty, what are we really trading, and what are we getting for that? So,
well,
the
let me
stories go
ask
on
you.
and
Let me
on.
ask you a question.
Please.
She paid her premiums, she paid her copays, she paid her deductibles, and yet she was still on top of that responsible for $40,000 worth of bills. Did she consent to each one of those bills as they were being incurred along the way? Did she know what the expenses were going to be? Why is there even anything on top of your premium copays and deductibles?
Well, because the health gangsters are pillaging us every single day. She had a high deductible health plan, which half of Americans have now, and that means the first $5,000 or $10,000 are out of pocket. So that's gone right there. The fine print, though, is where these companies really get you. And it's not just the insurance companies, frankly, it's the health systems that are also engaging in some of these unsavory practices. This patient went into the ER several times during her sort of treatment course, and she one of the anesthesiologists or the ER doc wasn't in network. How was she supposed to know that? She went to the place that was closest to her home. She was referred for, a special procedure and a special medication. And this is what her board certified oncologist and surgeon are recommending to her. And that ended up, a few of those treatments not being covered under her policy. And so those are all out of pocket expenses. So this unfortunately happens much more than we realize, Jack. Here's a question I think you'll probably understand the answer to based on what we just said. But what do you think is the number one cause of bankruptcy in the United States, personal bankruptcy?
This might be the easiest test I've ever taken, but I'm going to say that the number one cause in personal bankruptcy in America has got to be unexpected health expenses.
Absolutely. Medical debt. 56 million people every year struggle with medical debt. These are folks that are typically not, low income like we may ascribe to inappropriately. These are typically middle-aged folks. We have people taking out credit card debt to pay off their bills, and then they are laden on another, 20%, 28% interest on that. 90% of people who have high medical debt and who have a home take out a second mortgage to pay for their medical debt. How crazy is that to think about? 90% of people who have a home and who have expensive medical debt take out a second mortgage just to pay for their own health. That's in addition, like we said, to their deductibles, to the premiums, to all the costs their employers are paying on their behalf. We're fundamentally broken, Jack.
Why is everything so expensive? Now, I understand that we cured this woman's cancer. Amazing. And I understand more directly why research and development expenses around treatments and pharmaceutical treatments are so expensive. It costs a lot of money because partly due to regulatory requirements, approval processes, all the various elements that be laden on by the FDA and others. But generally speaking, it feels like everything, not only is the payment structure screwed up, you pay your premiums, you pay your copays, you pay your deductible, and then insurance doesn't even end up covering the massive amount of expenses you're enduring. Why is it so expensive?
Well, that's a complicated question, Jack. I mean, it is multifaceted. The United States very much subsidizes healthcare across the world. That's why prices here are so expensive, is many of the drug manufacturers, the device manufacturers, the insurance companies are kind of saying, to your point, all that R&D is typically done, in these trials in the United States in order to bring them here. And that's where they sort of put a lot of these costs. But, there's a great paper a few years ago that really broke this down. And there's a classic line in kind of healthcare economics that it's the price is stupid. Every single thing in American healthcare is more expensive than anywhere else in the country, whether it's a pill of Tylenol, whether it's a physician's salary, whether it's an MRI, the unit cost of everything is just higher. And, there may be many reasons for that. The corporate folks that are sort of justifying those costs would say it is to offset those things like research and development. But frankly, in a capitalistic society where profit is sort of the motive and shareholders are who your real stakeholders are, physicians, health systems, patients sort of become the widgets on the way in order to, maximize that kind of profit. So unfortunately, I think one other big aspect of this is the lack of transparency. As we mentioned earlier, none of us know how much anything costs in any healthcare setting. There's a great study that kind of went around and asked CFOs, chief financial officers of healthcare systems, how much does a CT scan cost in your system? And universally, they were not able to answer that question. It was always something like, it depends. And that's, at best, if they had an answer to it, at worst, they had no idea how these various, insurance rates are negotiated or how much the price is. We don't fundamentally tie the cost of goods and services back to the price that we're charging. These things are completely divorced, and we're sort of seeing the aftermath of that now.
So when I go to the hospital, I'm in the hospital and they come and give me a Tylenol and they charge me like $1,000 for the Tylenol pill, which I'm exaggerating here, but it's it's a generic drug that you can go to CVS and get for pretty much nothing. Why are they able to charge such exorbitant prices for things that outside of that setting, outside of that urgent circumstance that you find yourself in, with zero pricing transparency at a time of need and crisis for yourself? Why are they able to charge so much for something that you can get for so much cheaper somewhere else at any other time?
Well, because they can get away with it. There's
Ugh.
the inelasticity of healthcare, and in that, you know, people need healthcare, especially in those crisis moments when they're in emergency sort of settings. You're not sort of shopping for the best price or shopping for the best rate at those kind of circumstances. And so you're kind of beholden to whatever these health systems do charge you. They would say that, look, for every $50 Tylenol pill that we're administering, which is not an exaggeration at all. We can show some, bills here around, how much line item things cost in different healthcare settings. But they would say it's all the nursing and the machine that had to dispense it and the computer system and all of the devices and everything there. And maybe there is some truth to that it is more expensive than just, taking a pill of Tylenol. But the problem is the same exact service, the same exact procedure in different settings is often a vastly different price. If you got a colonoscopy, a screening colonoscopy in an outpatient ambulatory surgery center, which is very safe, typically has better quality and better satisfaction than an inpatient setting, a price around that might be $700 or $800. The exact same procedure done in the hospital is, an order of magnitude higher in many cases. So, frankly, Jack, it's because no one is checking these folks, and greed and profit are very powerful motivators.
So they basically have carte blanche to take advantage of you in your most vulnerable circumstances using an opaque and purposefully difficult to understand pricing structure, where at the end of the day, they hand you a bill you're on the hook for, where you have to go home. And if you are so lucky to have a home with equity in it, take out a second mortgage on your house to pay it off. And if you're not, you end up either choosing between feeding your kids or sending them to school or filing for bankruptcy. It doesn't seem like the system is sustainable, and yet it persists on year after year. Now, yes, it seems like we have the most amazing technologies to solve some of the craziest circumstances in health, but overall, it feels like we're getting kind of crap healthcare, because isn't everybody getting sicker and fatter and having more chronic disease? And actually, even life expectancy went down in America for a few years recently outside of COVID. Why does it feel like we both have like Star Wars future technology solving crazy problems, and yet people are getting sicker and sicker by the day?
Well, I think that's where the profit motive comes in. We fundamentally have a system of doing stuff equals getting paid. Keeping people healthy may or may not get you paid. There is a shift now away from like fee for service, volume based healthcare, more to value based care. And you'll hear that where organizations that keep their patients out of the hospital, that get all their preventative screenings, that control their chronic diseases, have payment structures where they actually can profit handsomely off of doing good in this world. Unfortunately, less than 5% of Americans are enrolled in those kinds of practices or in those kinds of payment structures. So most of the healthcare system is a fee-for-service system where the more procedures we do, the more time we take, the more expensive the technology we use, the more the system, the physician, the shareholders are sort of reimbursed for that. So unfortunately, I don't see this trend stopping. And like you said, we're not getting the value for those expensive costs. You would expect us to be unbelievably healthy and fit, and we're certainly not seeing that. It's all feeding the beast, Jack.
Okay. I'm kind of confused perhaps at who all the different players are in this system. It's so super confusing to me, and I'm paying attention. Imagine what it's like when all you're doing is working to put food on the table for your kids. Maybe you're making it to Little League practice. You guys are having a quick meal, tucking the kids for dinner or after dinner, and then you're getting up and doing it all over again. People just don't have the time to figure this stuff out. So let's help them understand. Explain to me the sort of business environment around healthcare. There's hospitals, healthcare providers, insurance companies, pharmacies, middlemen that I probably don't even know of. So, what are the major hubs and how do they work together?
Yeah, I think you mentioned sort of the big four that I would say. Health systems, uh, provider groups, pharma, and insurance companies are kind of the place where most of the dollars go. Health systems, account for something like 30% of overall costs in healthcare. Physicians are about 20. prescription drugs are around 10. And then, all these other things are, 5% or less. Folks like nursing homes and dental services, home health and durable medical equipment, the wheelchairs, and all of these things, they all add up. And like we said before, each of, the unit price of everything in the United States is more expensive than anywhere else. But all the dollars flow from us, the consumer, the individual, whether we are employed or not. It's coming out of our paycheck. It's coming out of our employer's sort of overall margin. And we are the payers. For some reason, we have all decided that we trust a third party with administering those dollars. And I understand why to some degree, because it is very complex. But my argument is that we've made it too complex. We've made it unnecessarily complex, and that's purposeful so that folks like the big for-profit health insurers can inject themselves in the middle and start to control the flow of all of those dollars. And that has rippling effects on things like what's covered and what's not, and who's in network and who's not. So the insurance companies are kind of the typical payers, as we say. I believe that we are all the payers. That would include, a commercial plan if you have that through your employer, like a Blue Cross or United or whoever. Medicare and Medicaid cover, about 50% of the country as well. These are government programs. We talked about this in our State of Sick America description. So check out that video if you'd like to learn a little bit more about that. But it all starts with sort of who's paying for stuff. The dollars then flow typically to the health systems. Increasingly, physicians are employed by health systems. And, sadly and frankly, bad for patients, I believe physicians are increasingly being employed by the insurance companies themselves as well. 100,000 physicians are now employed in some way or form by United Healthcare. That's 10% of the physician workforce that's active in this country. What does that do to their decision making, to their commitment to patients overall, when UHC's ultimate commitment is to shareholders? So there are all of these different players, Jack, and that's why it's so confusing. There's 100 other middlemen in between, whether they're TPAs or brokers or benefits managers, and everyone's kind of taking a little bit off the edges, and we're starting to see all of that administrative morass really build up on our per capita costs.
I've seen the charts. The increase in administrative costs as a percentage of total healthcare costs is absolutely outrageous. And what's interesting is that this is endemic to almost all of our institutions in the United States. If you look at the same thing in education, you see that the administrative cost of education as well has increased dramatically to dwarf the programmatic expenses as a matter of the whole entire overall cost structure. So basically what we're doing is we're creating these gigantic bureaucracies that are taking our money, divvying it up amongst themselves, people who aren't even providing you health care, people who aren't there to help you get better, people who aren't giving two flying F's about whether or not you're succeeding as a human being in this world, and then maybe paying for a little bit of the healthcare that you need. It's the same thing in education. I'm sure we can look at other markets as well where the government is involved, especially. And it's just, the chart is just like this. It's just like this. So is there some legislative reason? Is there something? Because this doesn't really strike me as normal market behavior. Why would all of the companies involved in healthcare increasingly take on more of these administrative costs to drive up the prices and yet keep the service the same level? In a actually competitive environment, you would see another player move in who's got lower administrative costs, offer a better, cheaper product to people, and everybody would swarm to that. And then you would see these costs come down to as close to cost as is possible for a company to achieve a reasonable rate of return. That's not happening here.
It's not happening, Jack. And I think, we I don't know if it's like an entropy thing or we just allow this to sort of happen. But I think the example you gave around the education is sort of what we're seeing in healthcare when it goes unchecked and no one actually has any idea how much anything costs. We don't have true competition. Some would argue that the legislative, regulatory, compliance infrastructure that we've put in place that is so complicated to navigate, and where the repercussions of not checking a box or submitting a form are devastating sometimes to clinical practices. You are kind of scared into ensuring that you have all of the administrative folks around in order to, make sure you can continue to deliver care. 30% of a typical clinician hospital's revenue is spent just on revenue cycle management alone. That's not marketing. That's not, infrastructure. That is literally 30% of every dollar is spent on just trying to get paid for the things that we've already done. And that is because the systems are so complicated, whether it's, insurance companies and the prior authorizations, or it's, being compliant with Medicare. All of it has led to just a massive burgeoning of the administrative class that then increasingly is now making decisions about your healthcare. And, something I have felt strongly about, and perhaps controversially, but I really believe that physicians, clinicians, others who are in that sort of true patient interaction day to day need to have much more of a seat at the table. You get this, this tired old trope of, well, doctors are bad at business. It's like, come on, we can read an EKG and diagnose you with cancer. Like, that is infinitely more difficult than reading a P&L sheet or understanding a corporate strategy. And so I really believe we need to empower clinicians who care about the right things to elevate into these kind of administrative physician or clinical roles where we can give our input and start to realize that we don't need probably 50% of the administrative class, if not more than that, in order to deliver a great product. Last thing I'll say again, Jack, is around transparency and competition, how important that is. When you don't know the prices of, whether health system A or health system B is providing a better product at a cheaper price, you can't actually drive down, cost at the competitive in a competitive way, because no one cares or no one knows or no one's asking the question, and we don't have that information. So we definitely need to reintroduce sort of this infusion of transparency into actual cost. And I hope that we will start to see people competing on that rather than just, the marketing.
Donald J. Trump, president in 2019, issued an executive order, I believe, that stipulated that health providers needed to provide pricing transparency for patients to allow them to shop for lower priced medical services and to generally help reduce healthcare costs overall. Issued in 2019, it is 2024. Healthcare prices and costs have continued to skyrocket. Are people just ignoring this executive order? Are they failing to comply with the government? Like, what? Tell me, you've been in the seedy back rooms. What's going on there?
I think that was one of the best executive orders in healthcare that I've seen in a long time, and I give credit where it's due. I think, frankly, something like 80 to 90% of healthcare systems right now are out of compliance with that rule and with that law. And there's actually not that many repercussions. Now we're sort of starting to see like some penalties and things like that. And what they will do, what many of these health systems will do, is in the eighth link downstream of whatever web page, buried deep down, they will publish what's called their charge master. These are the absolute highest rates that they will charge if you had no insurance and you came in off the street and you wanted to pay cash for some price. They'll publish that, but that's not actually the price that anyone's paying. Humana or United or whatever will come to that health system and negotiate much lower rates because they're saying, hey, we're bringing you all these patients, so we want a lower rate for this. And those prices, those costs are all very much opaque and hidden behind contractual sort of legal agreements in which health insurers will literally sue these health systems if they are publishing the prices that they are charging to that health insurance company. So there are numerous forces at work that are not allowing sort of the sunlight to disinfect. We've talked a little bit about Mishi, another company that we partner with and work with, and that's really the fundamental core principle there, is really bringing transparency. What are the rates that a big health insurance company gets for the same procedure in whatever setting it may be? Those are the ones that should be transparently published. And that's where we can really start to see competition, where the health systems, the provider groups will start to decrease costs, as you said, as close to cost as possible, and have to compete on that. But we do not see that in this current day and age.
I want to get to in just a minute specific instances in which you believe that the various players in the healthcare environment are actually stealing from people. I want to get to that. But before we get there, I just want to talk about the consumer's perception of all of this. How comfortable are people in just their ability to assess what healthcare costs? How comfortable are people in their ability to pick a plan that is appropriate for them? How many people actually say with confidence, I know what my health insurance plan is and I am satisfied with it, and this is the choice that I am happy to make?
Well, Jack, here's pop question number 2, pop quiz question number 2. What percentage of Americans do you think can define these 4 terms? Premium, deductible, copay, coinsurance, which are core features of every single health insurance benefit plan that we have.
Well, if we extract from this sample of 1, I would say none, because I don't know what coinsurance is, honestly. I know what the deductible and the copay and the premium are. Coinsurance, I have absolutely no idea. So I would say 0.0%.
You're pretty close. It's 4%, meaning 96% of Americans fundamentally don't even understand the terms that they're looking at when they're asked to select a particular health plan. You're making a decision about your family's health and your financial health. And you're looking at this sheet during open enrollment period. Your employer puts this in front of you in November or December and says, choose a plan for next year. And you're just sort of expected to understand these things. We've made it way too complicated. We've made the whole thing, we don't have those terms when it comes to car insurance, right? You kind of know what you're getting. Most people understand car insurance. Here's my premium. Here's an out-of-pocket that I have. That's kind of it, right? Like, in many ways, we've gotten so far away from the core, reason that health insurance even exists, which is to prevent us from bankruptcy. So it's obviously not doing that. But Jack, it's purposefully complicated to confuse people, is my assessment after 2 decades of working deeply in this system. There's no reason to make it that way unless you want to purposely obfuscate what is going on in the background.
That's really disheartening, because this is such a huge expense in people's lives, their financial well-being, their plans for retirement, their children's stability, the stability in their home, community, all these things that we consider to be the fabric of American life are at risk because nobody understands the healthcare system, and it's deliberately confusing. And once you are in your most critical moment, you're asked, we all kind of consent in the moment, right? You're asked, well, should we, sew your leg back on? And you're like, yes, sew my leg back on. And they don't say, but it's going to cost you $36,492.23. Right. Would you like to get a second opinion? It seems to me oh man, this really goes against some of my sort of capitalistic free market tendencies. But it seems to me that like the consumer really needs to be protected in this instance. And in some ways, maybe the prices should be just fixed. And I know there's a lot of negative associations with that. And I know in your, macroeconomics or microeconomic textbook, when you do price fixing, a lot of other bad things happen. But somehow the consumer, the patient, these human beings need to be protected in their most urgent and vulnerable conditions from the most sophisticated and deliberate predators that we have ever seen in America.
I think that's a great way to describe what is happening. Extremely sophisticated, predatory players. Jack, employers spend close to $25,000 per employee per year on healthcare expense. That's in addition to the 8,000 or so that each of us are contributing individually. We talked about it in the prior video. If you want the premium plan for your family, you're literally looking at something like $50,000 a year. If you're in a small businessman, a small business, and you have 100 employees, your healthcare costs, now that you're mandated to sort of provide those to your employees, is upwards of $2 million just on that. Think about all of the productivity, all of the margin that could be poured back into the business, into growing the core purpose of the business, rather than providing this benefit that we've sort of given the responsibility to employers to provide. So, we are up against the most sophisticated PSYOP in American history, and it's up to us to see through that and to understand how we can break free from the matrix. But it's going to take time, and it's going to take a very deliberate sort of critical mass sort of rising up and saying enough.
This is a bipartisan issue that affects every single citizen in the United States of America. In addition to these issues that we've discussed today, there's just the ever growing specter of treating diabetes and metabolic disorders in America, with almost 100 million people pre-diabetic who left untreated within 5 years are going to be full-blown diabetic. And we already spend $1.2 billion a day treating diabetes every day in America. We are going to be spending 50% of GDP on treating diabetics and just leaking money into this health cartel in our lifetimes, unless something not terribly, unless something like magnificently, destructive happens to come along and change this system. I just want to lay this out for people. We're going to have so much healthcare expense as a percentage of GDP that we're going to have to make decisions around national defense, make decisions around education, make decisions around highways, make decisions around other regulatory programs that actually save people's lives. These are real decisions, or we could just increase taxes, right? These are real decisions that are going to be coming down the road if something doesn't happen. And my suggestion is that you, the consumer, you eject from this system. You just say, no, I am out of here, and begin to understand the ways in which you can build a health portfolio that will give you better health in your life, will save you money, and increase your levels of liberty in your life. Be healthier, save money, be free. This is sort of my mantra going into 2024. And I believe it's possible, but you're not going to do it by reforming this system. You have to eject from it, because doctors are leaving. The doctors that have any two wits about them aren't going to participate in this system any longer. Physician morale is declining every single year. Matches and residency programs are going unmet. There is shortages across the country, and it's not going to get better. It gets worse. Because not only is all this happening, but there's people that are actually stealing from us, like criminally stealing from us, Deep. And I want to get into a couple of these examples that you have here. Tell me what's going to make me get even more enraged than I am right now. Because some of this stuff you can just write off as it's complex. There's a lot of players. There's some weird regulatory issues that need to be dealt with, but there's also just pernicious actual thieving happening. Tell me.
Well, frankly, Jack, it happens across the entire continuum. We've talked a lot about the insurance companies and the robbing of our deductibles and premiums and copays and ever rising costs. But, you know, it's not like health systems or clinicians are completely altruistic either. Health systems often are at the center of rising health costs. They have all of the incentive in the world to continue to drive more services to you. So here's a great example. Before we implemented some of the penalties and rules, if you have a surgery and that surgeon botches your surgery and you need to come back to the hospital in 10 or 15 days, no one is actually penalized for that. The doctor makes more, the radiologist makes more, the hospital makes more. The patient obviously is the one that is most harmed in all of that, but we don't see that, right? We say that as clinicians, we say this is an unfortunate adverse event, but we know that there are actually many ways that we could have prevented some of those, unfortunate situations. We have examples of organizations. One's called Team Health. They got in trouble in Tennessee for, overcharging people that came into the ER for things like an earache or a UTI. They would sort of upcharge and overbill those kinds of things. We have physicians who are, getting sued every year by Medicare and other programs because they charged $1.5 million for assessments that they never did, or upcharge the patient for an extremely complex visit when they just came in for a quick 5-minute discussion. And those kinds of things are pernicious in the healthcare system. There's not that many checks and balances against that. There is still, quite a bit of the honor system that's out there that says, well, doctor, you tell me what you did in this sort of encounter and we'll pay you for that. And as much as we've talked about, how challenging it is to get paid for things, many times there are these subtle, very gray areas where making the decision to do more stuff to you is actually making clinicians and healthcare organizations more money. Classic example, I worked at the Mayo Clinic as a hospital-based physician, and I admitted patients every single day for chest pain. And there's a very specific sort of classification of whether you're having a heart attack or kind of just some damage to your myocardium. And there's a very vast gray zone there around, do you treat this patient with medications alone, or do you take them to a cardiac catheterization? A cardiologist who's seeing that patient might get paid a couple $100 for a consultation to give me their input and their advice and say, hey, put this patient on these 4 or 5 meds and I'll see them in follow-up. They may get paid $5,000 to go ahead and do that cardiac cath. And most of us would say, well, yeah, I want the thing. I want the procedure if you think I need that, doctor. But, the evidence would suggest that they didn't need that sort of procedure. But we don't actually have those kinds of checks and balances. So, whether it's the health systems, the health insurers, the providers, even at times, everyone is trying to extract as much as they can out of the system.
Let's summarize some of the horrible, crappy SHITTY ways that this system, which is supposed to help us generate health in our lives, flutogenesis, and treat us at our most vulnerable, are screwing us over. High deductibles, deliberately complex coverage plans, denied claims, overcharging for services, unnecessary procedures, surprise billing. There are people overbilling whole entire classes of people like senior citizens who have no one looking out for them at times, to the tune of $1 billion a year. Not only that, we're overcharging poor people who come into the ER to get earaches, strep throat, and pregnancy tests taken care of. Sometimes there's absolutely no justification whatsoever for these charges except let's get some more money. Physicians are given bonuses if X amount of people in their patient panel have received such and such medication, such and such vaccine. have received such and such screening, whether they need it or not, in any of those circumstances. Around every single nook and cranny, there is a greedy, profit-driven corporation reaching into your pocket when you are at your most vulnerable and stuffing it in their vault, and to the tune of billions of billions of billions and billions and billions of dollars.
Trillions, I'd say.
Oh, sorry, my bad. Actually, trillions of dollars. I was just thinking of individual healthcare companies.
We did a great analysis in the New England Journal of Medicine Catalyst a few years ago that showed that we waste $1 trillion a year. Just think about that. $1 trillion a year. And people have a hard time understanding these numbers. I tweeted this out the other day. 1 billion seconds is 32 years. 1 trillion seconds is 32,000 years. And it is an unfathomable amount of money. But we spend that much every single year just on things like duplicated tests. You went to the ER down the street for abdominal pain. They got a CT scan of your abdomen. 2 weeks later, you have the same kind of pain, but you're on vacation. You go to another hospital. They do the same exact CT scan. Instead of getting that exact record, you're exposed to more radiation. You're exposed to more stuff because people get paid to do stuff in this system. So trillions, unfortunately, Jack.
Trillions upon trillions upon trillions. If you look at the stock charts of various healthcare companies in America, what do they look like? They look like the same chart of obesity and chronic disease. You could just lay them over top of each other. Just like this, rising share prices, just like this, rising rates of chronic disease, obesity, diabetes, all of the terrible things. Now, we've talked about this a little bit, but what is the average American supposed to do in the face of this sophisticated, pernicious, criminal enterprise, fraud, waste, abuse, theft, stealing from us every single day and every single turn? What can the average American do?
Well, it's not easy, Jack. I think first, one must have courage to kind of step out and the wherewithal and the intelligence to sort of research and understand what is happening to them. We think that we've developed sort of a blueprint for how could you opt out of the criminal gangster cartel if you wanted to. I think it first starts with step one being great, comprehensive primary care that's individualized and personalized to you. There's a lot of direct primary care practices out there. Rebel Health, our practice is structured in this way where, we get paid a cash price, sure, but if you weren't paying for insurance and all of your deductibles and your premiums, this is a vastly cheaper option. Would you rather be paying your, $28,000 a year to get your 7-minute appointment with your PCP, or would you rather pay a monthly rate to a great practice that wraps around you, that keeps you healthy and well and cares about you and is not beholden to any other sort of entity? So step one is getting really comprehensive preventative care so that we don't need to engage in that expensive sick care. The vast majority of money is actually in our healthcare system is actually spent in the last year of life when people are very sick and on death's door. That's when all of these expensive procedures and everything happens, when they go into the nursing homes and when all the bad stuff happens. But we should be able to prevent that far upstream. Step two is we need a radical sort of revolution in transparency around specialty care, around procedural kind of care. Inevitably, even if you've got a great team and a great primary care doc that cares about you and knows you well, you're going to need, your cortisone injection in your shoulder. You're going to need glasses. You're going to need something that requires that. But what we don't need is an opaque black box where we have no idea how much a surgery is going to cost if we're in, a terrible sort of situation. We're not shopping again for that, but we need to re-inject transparency in. That's what we're sort of building with Mishi. Last is we need that catastrophic sort of insurance where if something bad does happen, look, bad stuff happens in life, right? We get into car accidents, we get diagnosed with cancer, and again, America is amazing at treating you in those really, tough situations when you're very far down the continuum. The problem is that a lot of those treatments are tens and hundreds of thousands of dollars. So the typical person needs what we call stop loss insurance or indemnity insurance that says, okay, anything over $5,000 is not on you. Much like our car insurance, right? Like we pay our deductible or our premium that's very nominal. We're not using insurance to get our oil changes or filling up our gas. We're paying cash. That's what I would sort of, liken to our, primary care, comprehensive sort of primary care infrastructure. So there's a lot we can do, Jack, but I fundamentally think those three are the core pillars here of how you can break out and opt out from the current system.
People always ask me, what should my health financial package look like? What are the choices that I should make in order to eject from this corrupt, disgusting, revolting system that we are really captured by? I'm just going to summarize. 1, get a direct primary care that's focused on creating health in your life and heading off and preventing chronic disease. 2, use a cash pay marketplace that delivers price transparency when you need procedures, broken bones, specialists. 3, some sort of catastrophic health insurance where if you get run over by a bus or you have some rare cancer, you're taken care of over X amount of dollars. I believe that with that the 3-point system there that we discussed, this is the blueprint for the future of American healthcare, and it will be cheaper. We will be healthier, and we will have more liberty in our lives, less government too, and everything will be much better. And we need some radical transformation, just like this, or hungry mungry, Shel Silverstein reference, of diabetes and chronic disease, and the cartels are just going to gobble up the entire GDP until we're choosing between school books for children and insulin for the 99% of people who are diabetic in America. I exaggerate maybe to make a point, but that is the path that we are on. Now, one little pitch here at the end, that direct care primary practice that we're talking about, that's what we're doing at Rebel Health. Go to rebelhealthalliance.io and check it out. Lays out the entire program, how it works, why it's the right thing for you. It's the last little sales pitch. Check it out, please. Deep, thank you so much for your time here today. This has been enlightening / enraging, if that's a word. I am all fired up. I'm all jazzed. I appreciate your time. Guys, thank you so much for watching. If you like this, please hit like, please subscribe to the channel. Please share this with people so that we can spread the word and people can begin to understand the problem that we're up against. And if you want to stick around and watch the next video, just click on this one right here and we will see you the next time. I'm Jack Murphy. This is Dr. Deep, and we are out. Thank you.